Welcome to First Fertility PGS Center. It is our pleasure to help you fulfill your dreams to become parents. First Fertility PGS Center is proud to be the second IVF center which is accredited by Joint Commission International. In the past 5 years, we have worked hard to achieve the highest success rate with the most friendly atmosphere. On first coming to First Fertility, the patient will receive a warm welcome with our care and in a cozy place which makes you feel like home. Our customer service will assist you as your personal assistant. They will help you get started with the registration. Just a passport and marriage certificate are needed for the registration process. Customer service will help you fill out all of your personal data and medical history into our registration form. Before our patient goes deeper into the particular process of IVF treatment, our customer service will provide basic information about the treatment and each step which you will need to go through. The patient will meet our nice and kind nurse who will greet you and check your blood pressure and take your history. With JCI standard, the name on the label must be checked by the patient before the blood test in order to avoid mismatching the patient and sample. After checking blood pressure and taking history, the nurse will collect your blood to test for hormones and infection to determine if you are ready for ovarian stimulation. Waiting for the blood test will never feel too long, as the patient can enjoy a nice and cozy atmosphere. Once the blood test report is ready, the patient will meet with the doctor for consultation. A transvaginal scan is needed to count the follicles and measure the size of them. If the size and number of follicles and hormone levels are considered to be good enough for stimulation, the doctor will prescribe medicine for ovarian stimulation. The number of follicles must be counted by the doctor using ultrasound. Each follicle contains an egg. The number of eggs we collect is expected from the number of follicles. Regarding hormones, estradiol, follicle-stimulating hormone, FSH, and progesterone are the main hormones related to follicle development. The hormones should be in the appropriate level. Our professional nurse will prepare the medicine accordingly and give an injection to the patient. The injections must be done daily until your follicles develop to a suitable size for egg collection. During ovarian stimulation, a high-protein diet, electrolyte drink, and egg whites are recommended to the patient to reduce discomfort. Food is also important for patients who would like to improve egg quality during ovarian stimulation. After the long journey of ovarian stimulation, egg collection will be performed. The patient will be well prepared by changing clothes before going into the sterile area in the operation room. With our assistant, the patient will experience a calm and pleasant atmosphere. Our professional nurse will give you antibiotic medication by IV infusion. The procedure of egg collection must be started on time. All the processes are conducted by our specialist doctor and professional anesthesiologist and nurse. The patient will be put to sleep by medication under our professional anesthesiologist, and there will be no pain during the procedure. Each follicle is retrieved one by one into the tube and will be sent to our laboratory. Embryologists will look into the fluid in the tube, finding the eggs through a microscope. On the other side, the male partner will spend his time in a comfortable private room to collect his sperm. The sperm container will be brought to the laboratory for sperm preparation and sorting. Sperm will be injected into the eggs directly by ICSI method. The embryos will be cultured in the incubator and develop to beautiful blastocysts. Cells will be cut for chromosome screening. After the completion of insemination process by IVF or ICSI, the eggs are fertilized culturally in the laboratories for 5 to 6 days. Then the embryos are graded by the specialized embryologist. The grade of the embryo provides the information about the chances of becoming pregnant. This embryo grading process is mainly used to determine which embryo should transfer or freeze, or which embryos need to be discarded. This grading system will generally be performed on day 5 and day 6, based on the developmental procedure. From the bottom of our report, as shown below, is a guide on how our IVF laboratory assesses blastocyst embryos using the grading scale created by Dr. David Kay. For example, this blastocyst is graded as 3AA. Initially, a blastocyst is given a numerical score from 1 to 6 based upon the degree of expansion and hatching status. This part of the assessment can be performed on a dissection microscope. The second letter is letter grade for inner cell mass. The second step in sorting the blastocysts should be performed on an inverted microscope. The development of the inner cell mass, or ICM, can then be assessed. The ICM is given a letter, the highest score being an A. The third letter is letter grade for trophectoderm. The third step for scoring the blastocysts should be performed on an inverted microscope. The development of the trophectoderm can then be assessed. The trophectoderm is given a letter, the highest score being an A. From the embryo grading system, the patient will know the quality of embryo and fully understand which part of the embryo is taken for chromosome screening. To biopsy for chromosome screening, the embryologist will take the cell from trophectoderm in order to avoid any damage to the inner cell mass which will form the fetus. From the chromosome screening, the patient will have confidence in choosing a healthy embryo with no abnormality for healthier conceiving. First Fertility offers two methods of chromosome screening: PGD5 probes and NGS. PGD5 probes screen for 5 chromosomes, chromosome numbers 13, 18, 21, X, and Y, sex chromosomes. These chromosomes can cause major genetic diseases such as Down syndrome, Patau syndrome, Edwards syndrome, Turner syndrome, Klinefelter syndrome, and XXX syndrome. NGS is more comprehensive as they can screen for other abnormalities in every chromosome, so NGS can reduce the risk of miscarriage and the number of IVF cycles needed to achieve pregnancy. Through a protocol of witnessing patients and samples in our laboratory, we can reassure the patient that mismatching is eliminated. However, all the embryos need to be frozen safely in our nitrogen tank, waiting for their parents to pick them for embryo transfer. The embryo transfer can be started according to the menstrual period. For the process of frozen embryo transfer, or FET, the patient needs to prepare the womb for embryo implantation by taking hormone pills and applying a gel or patch to thicken the endometrial lining. The ideal thickness of the endometrial lining is between 8 to 12 millimeters. When your endometrial lining is perfect, progesterone hormone will be given to soften your lining and ready it for your embryo to rest and develop into a baby for 42 weeks. Before FET, the doctor will appoint a final meeting for embryo selection. You can select your preference to transfer under the doctor's supervision. The number of embryos to transfer must be decided as well. Normally, the doctor recommends 1 embryo transfer if the embryo quality is good, and only singleton pregnancy is expected. However, it is sometimes possible to have twins from the splitting of an embryo. In case the embryo is not in good quality, the patient may request for double embryo transfer to improve the pregnancy outcome, but there is a higher chance to get twins too. Your selected embryo is thawing on the morning of the transfer day. On FET day, the patient needs to change all of their clothes before going into the operation room. Moreover, an ultrasound scan must be done on the abdomen, so a full bladder is expected. The patient needs to drink a lot more water to have a full bladder before the procedure starts. Once the bladder is full, you will be moved to the operation room. During FET procedure, the patient will be fully conscious and the partner is allowed to stay to be a witness to this process. Your embryo will be taken into a small tube, and the doctor will send the tube into the womb before pushing the embryo into the womb. This is the process to send your embryo into position where it should implant and grow into a baby. Following FET, 1-hour bed rest in the recovery room is recommended. The patient must be more careful, walk slowly, have clean and healthy food with high fiber, and a hot bath. Lifting heavy objects and exercise must be avoided. Eight days after FET, the patient can do a blood test to check for pregnancy. Beta HCG levels above 25 milli-international units per milliliter is considered positive for pregnancy. Less than 25 milli-international units per milliliter needs to be retested to see if the levels rise to confirm pregnancy. Once the pregnancy test is positive, the medications are still necessary. They must be taken for 2 more months, and the patient should monitor the pregnancy as spontaneous pregnancy. After a positive pregnancy, the patient must be more careful, walking carefully and making sure your activities are pregnancy safe. Get enough rest, eat healthy food, and make prenatal appointments. For international patients who need to take flights back home, you can avoid walking too far with a medical certificate for a wheelchair requested from First Fertility. Your baby is our best reward, as our mission is to achieve the highest success rates and customer satisfaction. It is our pleasure to help you fulfill your dream to become parents.